Welcome to the Menopause Hour, your go-to source for answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, where menopause care is made easy. Download our free Winona community app where thousands of women connect and access exclusive content, expert-led courses, exciting events, and more. It's time to take the guesswork out of your hormonal journey.
Hello, everyone. Welcome to our March Doctor Dialogue. I'm so excited that you guys are here. I know that we'll have a couple people jumping in as the numbers kind of tick up a little bit, but just wanted to say, so glad that you guys are here and you're making the time to be here tonight. If you want, I always think it's a kind of fun thing. And just in case you haven't been here before, at the bottom of your screen, there's like a little chat button. And so like in the chat, that is going to be your best place to kind of engage tonight. And we really want you to, either listen in, engage wherever you feel like you need to be. That is what we want you to be able to do. But we're so glad you're here. As you can tell, we have some amazing doctors on the call with us tonight. We have Dr. Kat, who may be a familiar face to you. But we also have a new face, Dr. Hahn, which is super exciting. And that is one thing I love about these doctor dialogues is that we get to bring, these experts together to really have a conversation and chat about all these kind of topics that might be on top of mind for you. And tonight we're talking a little bit about surprising signs of perimenopause. We're going to get into that topic. And then at the end, we'll have some time for Q&A as well. So I do always say that the questions do often come pretty rapidly, and we try to get to as many as possible. So even though that's going to be a little bit more in the second half of the call, please start throwing those questions into the chat now, and I'll take a look at them and make sure that we can get to as many as possible. But I just want to say again, thanks for being here. We hope that this is a helpful call, and I will pass it off to our doctors to introduce themselves and get into the topic. Maybe Dr. Kat, we'll start with you, and then Dr. Hahn, I'd love to go to you as well.
Because a lot of the women, if they've been in and around a Winona, they've seen my face, so they've known me before. But I'm Dr. Kat Brown. I'm the medical director at Winona, and I've been one of the prescribing physicians since December of 2021. I'm a board certified OBGYN, nationally menopause certified as well. Grew up in the Philadelphia area, and now I'm back to this area after working in the Army for 12 years and moving around the country a little bit. Also a mom of 3, and I have several hobbies that I like to do, and it's finally starting to warm up here, and I'm hoping to get out in the garden soon because that's one of the things I love to do. I'm just waiting for the rest of our snow to thaw. There's still some like dirty piles of snow in the corners of everything. Yeah. So I'm waiting for all that to go away. But anyway, happy to be here. Love doing education for patients. And we're so happy to have Dr. Hahn. I actually had the benefit of meeting Dr. Hahn a few months ago. We had a Winona Women's event. So happy to have her here. So I wanted her to introduce herself because she's our special guest tonight that you don't often get to see on our Doctor Dialogue. So Dr. Hahn, take it away.
Thank you so much. So I'm Taylor Hahn. I'm a dual board certified OBGYN and an obesity medicine, and also a certified menopause practitioner. So I do kind of the full scope of women's health when outside of pregnancy is kind of how I like to frame it. So I am based out of Indiana, and I do own my own private practice as well, where I am able to practice all of those things, and it's in a direct care model. So out of network of insurance, which is the nice thing because I can actually really spend time with my patients and get to know them. But I love also being involved with some of the digital platforms, because I just think that I can only take care of my small little region of the world, or even of the United States and this little state that I'm in. So I love the reach that digital platforms can, that have the capability to move forward. So happy to be here. We are also getting warmer weather here, and I can't wait because I'm very much like a runner and like person to get outside and move outside with my kids. So yeah.
Yeah, we can't wait for the warm weather. Like we've had a tough winter this year for sure.
Yes.
Yeah.
Yes.
But we'll jump right into the topic of tonight, which was surprising signs of perimenopause. And I think that this is a great topic to go into because I think a lot of times when women start doing the deep dive and starting to research and trying to figure out what's going on, many of us have kind of heard that our periods start to get a little out of whack. And we know that like periods can get irregular, but there are so many other symptoms that can really creep in that can be kind of like sneaky and indolent that we don't really know that that's related to our hormones. So what's the strangest thing that you've heard from patients recently, Dr. Hahn, that a symptom that is, kind of unusual and surprising to the patient that they didn't realize it was perimenopause?
Yeah, a lot of, I've actually seen it, I think, mentioned a couple of times on social media as well, which is so nice to be able to also sort of validate for my own patients, like, no, there are other people experiencing this
Yes.
too. But not just the itchy ears, but like itchy sort of just in places where you wouldn't anticipate would be itchy, right?
Mm-hmm.
So like, I've had patients who have talked about like their eyeballs itching and like nostrils. And I think it kind of all speaks to, or not, maybe not all, but some of that portion speaks to the hormonal changes and hormonal fluctuations and, what we know about, where hormones, attach to in the body.
Yeah, absolutely. Another one that I keep getting over and over again, which actually was one of the things that started affecting me personally too in my early 40s, was joint pain. But I've had an enormous amount of women lately that are experiencing frozen shoulder, which is something that's really kind of an unusual sign that a lot of women don't think about, because often we're thinking like women's health, our ovaries, our uterus, and we think automatic hot flashes and night sweats, but a lot of women don't realize how much estrogen affects the joint spaces and the tissues. And so like our ligaments and our tendons, our muscle, even like the synovial fluid in our joints and how the joints glide and how they move, like gets affected negatively when we start to have a loss of estrogen. So that frozen.
That's what I was going to say is just that lubrication part of the joints, and a level of stiffness that you never experienced before.
Yes. It's like you wake up and suddenly it's like overnight you feel like you've aged tremendously. Like all of a sudden you feel like, God, like I feel like I'm in my 70s all of a sudden.
Yes.
Things are making like all kinds of Rice Krispie crackling noises when you move and everything.
Oh my gosh.
Stiff and tight. Yeah.
Yeah. And also I think that speaks a lot to recovery. So I talk to my own patients a lot about, I don't need your movement. I don't need it to be like an hour-long HIIT workout where you are killing yourself, right? Because a lot of it goes into how well are you going to recover after that. And so I talk to patients about that a lot because, we think sometimes that we're in the same shape that we were 10 years ago. And so we try to do the same things, but it speaks so much to how we're recovering, especially in perimenopause, that it's a big difference.
Yeah, absolutely. And I notice like if you ever do anything that's really out of your normal routine, like you feel it the next day. Yeah, that recovery is definitely harder as we get older, for sure.
I picked up tennis again for last year for the first time in a while, like probably a decade or so since I've like really actually like played or tried to be competitive in any way. And I thought I was having like spasms or like some kind of spastic disease process because because my feet and my calves and everything, like just all of my muscles, like the things that you don't really think about whenever you get into your day-to-day routine, that I see my kids do like every day, and you think, oh, I could totally do that. And you're like, I definitely can't do that, and I'm never going to do that again. So, so it definitely is you have to rethink your approach to movement and just exercise and being safe. So.
Yeah, no, absolutely. And that's important too. Like if you're not someone who's normally doing certain activities, like it's important to kind of listen to your body and not jump into something that's a total different change for you, because you could hurt yourself for sure.
Absolutely.
Yeah.
Another one that I have seen quite a bit, and it's maybe not strange, but I think it creeps up on a lot of women in perimenopause because they're sort of expecting the opposite, is the more frequent periods and the really irregular, weird bleeding. I think sometimes we chalk it up to stress and maybe stressful events or life events. But I think most people, when they think of menopause, they think about your period spacing or skipping.
Right.
And for so many of my patients, it's the complete opposite. I mean, they are experiencing periods like even a week or more early than what they have been like on a schedule for, as long as they've had periods.
Right. Yeah. Like someone who's been regular.
Oops.
Oh. Looks like Dr. Cat may have dropped for a second. We'll see if we get her back. We'll come back. But Dr. Hahn, kind of like while we're waiting, I actually had a question that, oh, wait. Dr. Cat, you back?
Oh, I just did a little thing saying my internet connection was unstable. Sorry about that.
Oh, no,
you paused for a second, but just for a second.
Was I making a really crazy face in the freeze?
No, actually you weren't. You looked great.
That's always my nightmare when you freeze and you're like,
yeah. Exactly. Yes. No. So it's just like I think that we tend to sort of write it off a little bit. But whenever I really sit down with patients and even have them go through like an actual like chronological diary of their periods or just their bleeding pattern, the light bulb goes off and they're like, oh my gosh, you're so right. I'm having where my periods were 27 to 28 days apart. Now they're 23 days apart. Like, what is happening? And the flow has changed, and the way that the blood looks has changed. Like it's very sometimes subtle, and maybe not the strangest part of perimenopause, but I think it's interesting how many more patients I see who actually have more frequent bleeding than skipping periods or losing them. So
that's very common. Another thing that affected me, and I've noticed with a lot of my patients recently, and even some of the nurses I work with at the hospital were talking about it just last night on my shift, is the change in tolerance of smells and the change in your sense of smell. Like, I don't know if you remember, like when I was pregnant with my kids, it's all of a sudden I became like a hound dog and I could smell the most putrid smell from like miles away, it seemed like. And I was just very sensitive to smells. And it feels like in perimenopause, that comes back. It's like all of a sudden there could be something and I'm just like, I cannot be in here. I need to move away. Like the smells just are so offensive sometimes.
Yes.
Like people are like, I don't know what you're talking about. I don't even smell it.
No, I have quite literally had that experience where you're like, am I having a stroke? I'm not having a stroke, right? So, where you like think that, and as especially as medical professionals,
we know too much, and so it's you go down the rabbit hole of wondering what's wrong with you when you start to have symptom. Yeah, for sure.
Exactly. So, but no, I totally agree with you on that one. One of the other ones that I see pretty frequently, and again, it's never to say like, oh, this is all chalked up to perimenopause and hormone fluctuation. New onset, maybe worsening, but new onset anxiety, panic attacks, especially. Like for some of my patients who have never experienced any kind of anxiety, I know that sounds weird. Like, you have like some of the small pieces of anxiety or episodes of that. But I mean like full blown out of the blue panic attacks that we have to then navigate because, obviously we want to rule out a really serious component to the mental health piece as well. But once we've sort of gone down that road and they're able to kind of parse out everything, a lot of times it is, we do make that decision that yes, this is related to perimenopause. Like, and it can be really, really debilitating for some people.
Yes, absolutely. I think it definitely can be. The other thing too, that I think that, is not talked about enough, but I think more and more women, are having the conversation is that your sexual desire, your sense of self-confidence, all of that. Like you feel kind of out of body, out of sorts. And so for a lot of women, that can equate to a change in sexual interest and libido. But also your body may not respond the way that it used to prior to menopause. And that can be sometimes really challenging for relationships in particular. And I know that you're looking at statistics. I think the divorce rate goes up for women in midlife for sure. Yes. Because not only are we getting increased anxiety, maybe our tolerance is a little bit low. I just remember like at one point just feeling like a monster because I was barking at my kids so frequently. And I was like, this is not me. Like, I don't want to be this mom.
Yes.
But so many different dynamics are changing. And it really leaves women feeling like suddenly they're not in control of their own body and they're not in control of their own life. And that can be really, really tough because most of us, by the time we hit our mid-40s, like, we're usually doing well in our careers. We've got our life figured out for the most part. And all of a sudden this hits us like this curveball and suddenly you're having to juggle and try to figure everything out again. And it can be really, really disheartening and really challenging.
And I think it also speaks to just the timing wise, like it couldn't, in some ways it just like couldn't be the worst timing because it's you're a lot of times approaching an age, like if you do have children and have a partner, you're approaching a time where your children become a little bit more independent and then maybe they're like going off to school or moving out of the house. And that is like so great. But then a lot of people come on as caregivers for a family member, like a parent. And so it's sort of like you're trading one caregiving for another. And it's not necessarily a symptom, right, of perimenopause, but I think it's a pretty common occurrence that unfortunately we don't talk about enough because people just kind of think, oh, this is my own stuff to deal with. Like, I don't want to, talk about it and bring anybody down. But that's a huge undertaking for anyone to do when you are anticipating the end of your periods and, and kind of moving on in a different phase of life, but then you end up kind of going back into the caretaking ring.
Absolutely. Yeah. And it's hard to stay afloat with all that when you're also dealing with like insomnia and you're dealing with trying to get through the workday amidst hot flashes and trying to deal with the unpredictable nature of your period. I mean, there's nothing worse than being, at work. And I don't know about you, but like, if I was at work and, in the middle of a surgery or doing something and suddenly your period out of the blue when you weren't expecting it for 2 more weeks, like, that just has an effect on your entire day,
Absolutely.
Like suddenly feel back like you're back in puberty and like not knowing how to navigate periods again.
Yes.
Crazy.
Truly. And then, talking about something that I think probably happens really frequently, even starting before perimenopause, but that we don't really talk about a whole lot, but could be a little surprising to some is the development of incontinence, urinary incontinence, leaking. I have a lot of patients who have sort of normalized that in their lives. And so a lot of times they don't bring it up unless I ask. Because they think it's so normal. But I always kind of talk to patients about like, this could get worse. When you lose that hormonal component to the vulva and vagina, that tissue is really thin. It can even further worsen leaking. And so just kind of talking to patients about what to expect and that could be something that comes up, I think is really important.
Yeah, I think it's really important. And it's so true that unless we ask or unless we have it on a questionnaire, like patients aren't going to volunteer. And there's a lot of that because like there's shame associated with it too. Like no one wants to talk about peeing their pants or having leaking.
Yeah.
And like who would want to bring that up in a conversation,
Yes.
And then that can also affect sex life and intimacy as well. Because
absolutely.
If you're dealing with incontinence and you're dealing with urinary leakage, you're probably worried and afraid that like, if you're going to be intimate with your partner, what's going to happen? Are you going to leak? What's going to happen? Are they going to be turned off? And that can then have this negative feedback to the libido too.
I love that you brought that up because that is like such an elephant in the room that when I feel like when when I finally get patients to start talking about it, it's just like this air that just goes like, okay, finally I feel comfortable talking about it. I feel comfortable talking about solutions or ways that I can adjust, my movement and my core strength and things like that to really not to like get big and buff, but to just like keep myself from peeing whenever I don't want it to. So, and especially during intimacy, that's a huge taboo topic.
Yeah, absolutely. Yeah. So hopefully, I mean, some of the women listening, I don't know if we're getting some questions in, Maddie. Has anybody typed anything in yet, or are we going to keep chatting?
I think we've gotten some listeners or we do have one question as well. And I actually also have a couple questions that I think could be helpful for our community to know as well, if we want to jump into those for sure.
Sure.
Well, our first one's from Val. Val says, can you talk about heart palpitations? Because I notice it more. I would like to know, if it's correlated to perimenopause.
Yes. So, I mean, here's the hard thing. Heart palpitations and other heart symptoms can also be a sign of something more serious. So you don't want to ignore it, but it is absolutely part of the spectrum of symptoms. And so many women experience them, myself included. I had $1 million workup for my heart too. I had a situation even before I really even knew I was in perimenopause. Well, I started feeling like intermittent chest pains and started having palpitations. And of course, I went right in to get checked out because I was like, oh gosh, something bad is happening. Like you were saying earlier, am I having a stroke?
Yes.
But so you end up going in, getting evaluated, because it's important to do that, because more women die of heart disease every year than die of breast cancer. And I think that's like, so many patients are afraid of hormone therapy and afraid of seeking treatment for perimenopause and menopause because they're worried about the risks of the treatment. But actually, if you ignore the heart symptoms, you could be ignoring something much more serious. So it's still important to get that checked out. But it is related to estrogen's effect on the heart and our internal pacemakers in our heart and that electrical activity of the heart, that we can get skipped beats, or you can get like, just a little bit of a palpitations, like where you all of a sudden are aware of your heartbeat and then you're not. Because we shouldn't really be walking around aware of our heart and feeling our heart fluctuate. It should be something that's kind of happened in the background, unless you're feeling your own pulse. Like you really shouldn't be feeling it. But I think that several women will experience this, when they're going through this change. But it's important not to ignore it. Like if you get pain associated with it, if you get sweaty or what we call diaphoretic, or you start to feel short of breath while you're having palpitations, or you're having chest pain, typically, under the sternum, under your breastbone, that can be a warning sign. So you definitely don't want to ignore that, and you don't want to chalk it up to perimenopause and not get it checked out. But palpitations are so very common. You said you had some too?
Oh, absolutely. And just like random times where it almost more like flutters, but just like feeling like it's racing, and maybe not even skipping a beat, but you're just like, I'm doing nothing different. What's happening? So
right.
Yes.
Fluttering. I definitely have experienced that. And it's almost like the way I can describe it is kind of feels like all of a sudden my heartbeat is almost in my throat for a minute, and then it kind of goes back down. Kind of very strange, but very, very common.
Yeah. I would also mention, just kind of associated with that or related to that, just changes that can happen with hormone fluctuation, just to like your cholesterol numbers and insulin resistance type of things. Like, I think we don't talk about that piece as much as more of like the symptoms, because that's what we're wanting patients to pay attention to. But I constantly see this like slow creep up of cholesterol, of hemoglobin A1C for diabetes and things like that. Like it's sort of the small things that you wouldn't necessarily think of. But I see that all the time when I'm running labs on patients, just to kind of do like an overall panel. And I'm like, hey, have you had cholesterol issues before? And they're like, no, I've never had an issue with that. So I see that quite a bit as patients start to get into perimenopause. So
yeah, absolutely. Yeah.
Definitely. Oh, and I think we do have a few more people typing, so I'll give them a minute to kind of get their questions in. But I did want to mention one thing that I think is really interesting that you both were talking about kind of in the beginning of the surprising signs to perimenopause. And, because I'm in the communities a lot, I see like a lot of the conversations that are really happening between a lot of our community members. And I think that one I see come up all the time is, I mean, just things about like strange itchiness, like whether that's, lots of different places. I think that there's like lots of different ways that manifests for people kind of in that way. And I do see that people are always wondering a little bit about where does that itchiness come from? Like, even if it is like a sign of perimenopause, like why does it happen? And is there a way to kind of fix that as well?
Yeah, I mean, it's really the effect of our fluctuating estrogen levels on the skin itself. Our skin is our largest organ in our body. But as we lose estrogen, the tissues themselves like lose elasticity, lose their ability to hold on to moisture. And actually, the skin itself actually loses some of its thickness of its layers as well. And so, what happens with that is that, we start to notice changes, especially in the skin of our face. Like we start to see signs of aging more, start to set in, but also the dryness, like we're not able to retain the moisture that we once were. Thinking back to when we were teenagers, like we could wash our face, do whatever kind of acne medication, and the next day, like our skin would be totally fine. In fact, probably be oily again, after using all these very harsh ingredients. Well, come your 40s and your mid 40s, God forbid you use any of those harsh ingredients. The next day, you're going to feel like a lizard because you're going to be so dry. And I never, ever thought in a million years that I would ever have to apply as much moisturizer as I have to apply right now to kind of get through the day.
Three layers of moisturizer, but you literally described like my exact. I used to carry those oil absorbing sheets.
Yes.
Like, in every bag that I had. And I remember distinctly, it was like post my second pregnancy. And I was like, oh, my skin feels dry. This is really weird. I haven't had to use those sheets or whatever. And like exactly what you just said, I used a product that I was like, oh, this is going to be amazing. Got some nice perioral dermatitis from it. Like, cause it was so drying. And I think that's one of the major conversations that I have with patients, who maybe are thinking about doing even like aesthetic treatments or chemical peels and things like that. I'm like, listen, you don't even have the basics, like the fundamentals down. Like we need like a good, gentle cleanser for you. We need like good layer of moisturizer that's not going to be clog pouring for you first before we ever trek down like the expensive peels and treatments and stuff. So it's like it really affects not just the skin too. I was going to mention hair follicles.
Yeah.
So it might not be like losing hair, although lots of women in perimenopause notice a significant amount more of hair loss. But it's honestly just sort of like the lack of growth. Whereas like it used to be, you could, like get your hair cut and 4 weeks later, you need to get it cut again because it grew so fast. And now you're like, I'm lucky if I can get like anything to grow anywhere. Yeah. But I see that a lot. I see the same thing or similar thing in postpartum patients as well, because you think about the hormones sort of dropping and declining drastically. When we get that huge hair loss postpartum, and then it takes so much more time to grow it back. Like I'm talking like eyebrows, eyelashes, like things that you don't really think about. But I've had lots of patients who have had those issues.
Yeah. And I think the other part too, like with the itching that women experience, sometimes the scalp can be very itchy as well. Yes. It's really related to those hair follicles changing and their like cellular turnover. Like they just don't respond the way they used to.
Yes.
But for many women that notice like their skin is more dry, they're itching on their arms and legs more often, especially in this winter time too, like sometimes it means like you can no longer take your long, luxurious hot showers anymore because the hotter the water is when we bathe, the more it denudes our skin of its natural protective oils. And so then that can catch up to more dryness. So You have to think about like dialing the temperature back, and maybe do more things that for ambient temperature control in your bathroom, like either getting a heated floor or having a space heater in your bathroom. Or one of the most luxurious things that I like is getting one of those towel warmers, being able to grab your towel, like, some nice hotels always have those. And
yes, I love that.
it's like, oh, these little life luxuries, it makes a big difference. But yeah, the skin itchiness is something that's so pervasive. So many women experience that.
Yes.
And I think we probably keep the moisturizer industry in business, like in midlife.
Truly. Yeah, absolutely.
Yeah. Awesome. Well, it looks like we have some more questions. Our next question is from Elena. And Lena is wondering, she says, can you talk about how we might separate perimenopause symptoms from symptoms of changing PMS? She says, as a 35-year-old woman, I find myself experiencing more noticeable PMS symptoms than I've not previously had to deal with. And I wonder if perimenopause is a potential explanation for that. And then she says, and from there, I would wonder about difference in treatment approach. For example, would HRT support be explored first over birth control pills? And then she says, thank you, in all caps as well.
What a good question. And
so good.
Yeah.
I love this topic too.
You want to start answering that for her?
I was just going to start with, and I won't go into like a whole monologue about like birth control pills and like how synthetic hormones oftentimes work very differently in the body than even bioidentical hormones that we use for menopause hormone therapy, right? So I think there's been a general consensus in, for us, Kat, as OBGYNs, that in perimenopause, it's totally reasonable and you should get complete symptom relief from a birth control pill. And that might be a better option than menopause hormone therapy because it gives you a little bit more of the cycle control, right? I think now we're understanding a lot more that that some patients don't get all of their symptoms treated with a birth control pill. And sometimes those types of hormones work very differently for one patient compared to the next patient. And so I think needing to take a little bit more personalized approach especially for my patients in their 30s. It's like the forgotten patient population because which I really try to hone in on that because they're the ones that I want to educate and want to be prepared for everything that's going to be happening to them, so that they do know the questions to ask. I really liked that you asked about, Elena, the difference in treatment approach, because I think the biggest question really usually is, do you need birth control? Do you need contraception? And if that's not the case, there really are not a lot of reasons why you couldn't potentially try bioidentical hormone therapy, because we know that it's really going to be, it's treating in a different way, right? You're not going to have as much of the cycle control necessarily with that. So I always kind of remind my patients like, hey, this could make bleeding a little more regular or, or different from what you're really wanting. But I think it's a really reasonable approach. What do you think, Kat?
Yeah, no, I think it is. And really that's important. I think that I have a lot of patients that start menopausal hormone therapy, and then when their periods are like totally out of whack, they want to tweak their hormone therapy to try to control the periods. And I'm constantly having to educate about how the bioidentical hormones are really helping to kind of supplement your body with the hormones it's not making anymore on its own. But it doesn't do as good at suppressing those cycles. So if if the periods are really a big issue, then it's not the best treatment option to try to regulate the bleeding. But I also think too, like as women are getting into perimenopause, she mentioned more about like PMS too. I have noticed a lot of my patients complain that, the PMS symptoms they had in their 20s or 30s get much worse in perimenopause. And, for women that aren't real familiar with what's happening in your body during the menstrual cycle, when we are going through our OBGYN residencies and we're learning, we study this chart of these hormones and it looks like a roller coaster. It's up and down and up and down.
Yes.
And really what happens in PMS is that right before our period comes on, it's this huge fluctuation time in all these different hormones in our body. And the symptoms you're getting, the breast tenderness, the bitchiness, like all these other things, the hormone changes. And so as your body is starting to change all those hormone levels in perimenopause, that can totally get exacerbated, and PMS can get worse. I mean, I've heard stories about like everyone in the family just staying away from mom, that time. It can certainly happen. So I have had women that, start menopausal hormone therapy around that time. And when their PMS is coming on, if their PMS is worse, like for those that are using like a topical compounded estrogen and progesterone cream, using an extra pump, like increasing their dose just for that week before. And that can sometimes help symptoms. I never encourage women to do that without talking to their doctor. Obviously, like let us know and we'll give you advice on what to do and how to tweak things. But I definitely notice PMS gets worse for a lot of patients when they're in this transition before they actually hit menopause.
Agreed. Yes. And I think that some people become really, really sensitive, not just to, that second half of the cycle after ovulation where you're bloated, you're fatigued, you're just, just don't feel good. You don't feel like hanging out with anybody, anything. But I think that people become even more sensitive to the full drop off. And that's because they sometimes maybe even starting a little bit lower and then you're just like totally tanking after. So
absolutely. Yeah. So many things we have to deal with.
So many things.
Great. It's so great.
Yeah.
And Elena, just on the end of that, she says, thank you guys. I feel so seen. It's so hard to find info on PMS versus perimenopause. She says, currently already on the implant, and my gynecologist has recommended a birth control pill on top of that. And I've been curious about other treatment options. She says, love you ladies. Thanks a lot. Yeah. Absolutely. But we do have another question from Dawn as well. And Dawn is wondering, she says, I joined to learn where I may be on the menopause curve. She says, I'm 54. I had my uterus removed at 48, along with adding a bladder sling. She says, for several years, I've dealt with difficulty finding words, hot flashes at night, although she says seems less during the day for the past year, itchy above my ears and very dry skin. She says, what treatments should I maybe at my age consider for these symptoms I'm having?
Well, at 54, even though you had your uterus removed before the age of 50, I mean, you're probably already postmenopause. I mean, you're probably already menopausal. The average age is 52. So if you still retained your ovaries, they were probably making a little bit, of their own hormones and might even still be in small amounts. But I think it's a great time for you to consider starting HRT at this point. And you're in that magic window that we know it's safest. And that's the really important thing to do too, because if you have a hysterectomy and you have your ovaries removed, really ideally you want to start hormone therapy right away if your ovaries are removed. But then when you're going through menopause naturally, like if we allow your ovaries to kind of go through the normal aging process, we have this window of time where it's safest to start hormone therapy, which is within 10 years of menopause, or before age 60. We just know that the risks are lower profile, lower risk for women that they start within that time frame. And so this is the perfect time to do it. And all the symptoms she mentioned are things that we see so often. The skin we talked about, the brain fog, and also the difficulty finding words, that goes along with that brain fog and having like the short-term memory issues and forgetfulness and having issues multitasking, so many different things. But the hot flashes, that would most definitely get better when you start estrogen therapy. And the beautiful thing is we know that taking estrogen therapy alone is really safe. And it's lower risk of breast cancer than taking combination. And because you don't have your uterus, you don't need the progesterone component of the hormone therapy, which is nice. So you have so many options. I mean, there's topical estrogen, patch estrogen, pills. We know that topical versions do better, and a lot of women tolerate those better, but we can use lower doses, so there's a lower side effect profile too. So many options for Dawn. This is the perfect time for her to explore. Yeah.
Absolutely, Dawn. I was also just going to mention that I think we're finding more data coming out too that, whereas probably when you and I trained, Kat, it was more oh, you had your uterus taken out, but you still have your ovaries, they're totally going to function the exact same way whenever you have your uterus out. And that's sort of that's the party line that we followed and that I even followed talking to my patients. I think now we're finding actually more studies and more data coming out that show that oftentimes that ovarian function is compromised whenever you're taking a large amount of that blood supply that it would be getting, right, from that connection to the uterus. So I think it's interesting to see that and what will come like even in the next decade. But I think we're finding that women are starting to experience symptoms earlier as well, just by simply having their uterus taken out.
Absolutely. And also because we take the tubes out now, prophylactically, that's a big thing too. So, years ago, we would just do the removal of the uterus. And, if you didn't have a history of having, some issues with your ovaries, like we left the ovaries in, we left the tubes in. But now we know that the tubes are the source of cancers. And so now when women are getting or requesting tubal ligation surgeries, or if they're having hysterectomy, we also take the tubes, which is called a salpingectomy. And the tubes, are like, I kind of think of like one of those fancy robes,
Yeah.
Think about, like,
they do look like that.
Yes. So like if your body is the uterus, your arms with the little fingers on the end, which are your fimbria of your tubes, are the arms of the robe. Then we have this long, flat part of the tissue kind of hanging down, which is our mesosalpinx, or just is basically connective tissue. The ovaries are right around there too. And when we're going to dissect these fallopian tubes to remove them, despite using energy that we think goes in one arm of the tool laparoscopically and back to the device, there has to be some lateral spread of that energy. Yes. And some of the tissue of the ovary gets a little damaged when we're doing those, like not to the naked eye. But I definitely think that that's part of the equation, that, sometimes we're getting that lateral thermal spread to the ovaries. Yes. They're getting damaged. And so they're declining their function as a result of us operating right next door to them on the tubes.
Yes.
So
no, I see Don said, I thought it was coincidental these symptoms started short. I actually prepare my patients now, like when I'm doing pre-op for them, we have that conversation like, hey, you are probably going to start having symptoms earlier. And that this is a good, your post-op time period is a good time to start having that conversation, and not to ignore them and just say, oh, well, you're post-op from surgery, let's give it 6 months before we do anything about it, because a lot of patients really do feel the effects of that really early.
Yeah, absolutely. Yeah, and I don't think it's recognized as much, like you said.
I don't think so either.
No.
Yeah.
So, well, we may have one more question or so on the way. I think there's a few being typed, but I guess, like, is there anything that either of you feel is like, especially when we're dealing with, signs of perimenopause that tend to be on the more surprising side, that women should be on the lookout for, or should kind of just, have the knowledge of like how to, address those if they come up? Because, I think we can talk about the surprising signs, but sometimes, there's things that we can do to either like prepare ourselves for that or what that could look like. I don't know if you have any thoughts on that end.
I think the biggest thing, some of these things kind of creep in one by one, little by little. And as human beings, we kind of start to assimilate little small changes into our normal and every day, and we don't notice them until they make a bigger impact on us. So I think that women need to be really good about being observers of their own body. And I think it's really important to start kind of like jotting things down, thinking about doing a symptom diary, because that's really the best way that doctors like Dr. Hahn and I can really help you, is when you come with that like information. And, if somebody comes to me with like a symptom log and they said, I'm having this happen every single day, or I'm having these symptoms, and I can look at what's written down as like a constellation of symptoms. It's so much easier for me to know how to treat them and what to do and kind of what dosage to start them on than if I don't really have that information. And I think that also helps women to recognize patterns. Because that's really important too, because some of these things are so subtle and they kind of creep in. But I think that, until you kind of look at the big picture and you see the forest for the trees and start to notice that, like, actually all these things have started around the same time, and they're just starting to get gradually worse. I think that that's important to kind of keep a log of, to help yourself to know when to seek care.
Absolutely. And then I was going to say too, just really remembering that you can just to be an advocate for yourself, because I think, especially since we're talking specifically about perimenopause, I think a lot of patients go in with kind of an open heart and an open mind to it, and want to ask questions, but sometimes might get shot down by their clinician, and they say, "Oh, you're too young. You're too young for perimenopause." But that's why I love having these conversations with patients who might even be earlier than what I personally think that they're likely to be in perimenopause or not. But I'm constantly surprised when patients describe all of their symptoms. I'm like, I actually think you are. I think you are in perimenopause. So, and just remembering that blood tests are not the end all be all. They can be a really helpful adjunct to your health information. But so much about perimenopause is just the symptom tracking, like what you were talking about.
Yeah. It's really helpful.
Yeah.
Great. We have a question next. We have a couple more thrown in here. We have a question from Marie. And Marie's wondering, says, how can we protect our iron levels when periods are closer together?
Yeah. So if you're someone who has struggled with anemia in the past, and you've dealt with like low iron levels after heavy periods or even during pregnancy, if you start noticing in perimenopause that your periods are getting closer together, it's important to kind of get a baseline CBC, I think, which is a blood count after the cycle, to see how low are you actually dropping, because you might benefit from iron supplementation. And then along with iron supplementation, the unfortunate friend that comes with that is some constipation as well, because almost always when we take oral iron, we don't metabolize all of it, and it can cause some constipation as a side effect. So you don't want to take iron unnecessarily. So I wouldn't just go out and buy iron. So, if you haven't had screening blood work, like with your primary care provider, to kind of see where your blood count is, and, check your, liver and kidney function and your cholesterol and all that, I think it would be important to get that blood count, especially after you've had periods back to back, to see, like, are you actually losing enough blood volume that it is affecting your iron levels? Because sometimes what we see qualitatively on a pad or in a tampon might not actually equate to a change in your blood work. And that's the only reason I would really recommend iron supplementation, is if your iron levels are low, your hemoglobin drops significantly.
Mm-hmm. Yeah, I completely agree. I do have some patients who, like you mentioned, don't tolerate the oral iron supplementation as well. And so there are definitely other alternatives that you can talk to your own clinician about too, if that's a concern for you. But I'm always surprised at how much the female body just compensates. Yeah. And it's really just, once again, it doesn't surprise me because women's bodies are amazing, but it's always surprising when I think, like, oh my gosh, you're going through like 3 Super Plus tampons in an hour, and like your iron is still beautiful. Your ferritin, your stored iron is awesome. Like your body was like made to survive for sure. So,
yeah.
And it looks like we have another question from Victoria. And Victoria's wondering, so she says, I started taking the cream and DHEA last year. She says, at first it regulated me, but now I'm seeing massive muscle loss, water retention in my legs, and I'm starting to notice my sleep is being broken up again. She says, my question is, what do I regularly check to help keep symptoms down, but not at the sake of others coming on?
Well, I think the important thing in that question, Maddie, is that she mentioned starting the meds a year ago. Depending on how old you are and where you are in this journey, as you continue to age, you might be on a certain dose of hormone therapy, but then as your ovaries are continuing their own aging process and they're kind of down-regulating how much hormone they're making, your symptoms may start to resurge. And it's not that the medicines aren't working anymore. It's just that you started a medication based on what your hormone levels were. And now if your own internal hormone levels are lower, you might need a dose adjustment to keep your symptoms under good control. Mm-hmm. So I would reach out to the doctor who's prescribing to you and let them know that you're seeing those changes, and maybe some adjustments need to be made in your dose to keep you feeling your best. So I think that's important. Yeah.
Yeah, I totally agree.
She did want to add that she's 51 and she says she's still getting regular periods. I don't know if that changed anything, but I thought I'd throw that in there.
Okay. Yeah, I think, as you get further into your 50s, that kind of goes along with the probably needing an increase in your dose as well, Victoria.
Mm-hmm.
Yeah.
Well, that looks like that was all of our questions for tonight that I'm seeing in the chat right now. But just as like kind of an ending note, since we've been talking so much, it's just kind of about perimenopause, the signs of it, kind of like all that goes into that. Is there anything that you feel is important to kind of leave the women here tonight or later on that are watching this back, just of something that they should know kind of just about perimenopause, about the signs, or just anything you feel like might be good knowledge, I guess, to impart?
I would just say learn as much as you can, read as much as you can, talk to your friends, make sure that you're keeping track of what's going on in your own body. We have to be our best advocates for ourselves. And I wish I knew your body as well as you did, but as your doctor, we only know what we see when we see you for 20 or 30 minutes. And maybe Dr. Hahn has more time, if you have that practice model, maybe you can spend more time with your patients, but you as the woman, you are living in your body day in and day out. You know what's going on in your body, and you are the best observer of what's going on. And so that's the big thing I would say is that, make sure that you're staying on top of really monitoring yourself, learn as much as you can so that you can be proactive about recognizing, and just educate yourself, educate your friends. That's the big thing I would push home at the end of these Q&As is that, this is a great opportunity for you to learn stuff, but then take this and roll with it. Go find reputable sources. We have some great articles in our medical journal page on Winona. You can go to the Menopause Society. They have great patient-facing information as well. There's more and more documentaries and stuff that you can watch in the comfort of your own home that you don't have to read on the internet. And actually, the one that I filmed last summer is actually going to be starting, I think, premiering this weekend.
Awesome. That's amazing.
If you go to revoke.com, which is the health organization that produced the menopause, it's a perimenopause and menopause documentary series. And there was several other OBGYNs that went. We went to Costa Rica for a few days, and they brought patients and put them all in a house together to talk and with all these experts. And I'm excited to see it. I hope that all my segments didn't get cut out too much, but
I'm sure they didn't.
But it was great because I got a chance to go to Costa Rica. There's another one called Balanced, which just came out recently.
Oh, so good.
I've been dying to watch, but I haven't bit the bullet to pay for the access to watch it.
Yes.
But that was made by two monks, which is actually fascinating.
Oh,
yeah. There's also the M Factor, which was out last year. There's so much. I think that, right now, this is the time, we are women living in the best time right now because there's so much on social media. Stars are talking about this. Women are opening up, and we don't no longer have to suffer in silence anymore. Menopause is kind of a buzzworthy thing right now, but I'm glad it is because education is getting out there and more women are going to have access to resources. And with the FDA removing the black box warning on estrogen.
Oh my gosh.
That's just going to see so many more doctors that weren't even considering adding this into their toolbox or that didn't care before. Now, if they want to keep up and they want to keep their patients happy, they're going to have to jump on the train and have to join us, Dr. Hahn.
Yeah. Yes. I think that's a really important thing that patients can, important but also simple, and sometimes might make patients feel a little uncomfortable. But you are more than welcome to ask your clinician if they feel comfortable managing perimenopause and menopause or evaluating it. And we as clinicians should be able to swallow our pride if we can't and say, you know what? I don't think I'm the best person to help you, but let me get you to the person who can. Let me get you the help that you can. So I think not taking the the paternalistic answer that is, I know what's best for you. You're not in perimenopause. You're too young. And taking that and challenging that and coming back and saying, I feel a certain way, and I know that this is not normal for me. So if you don't feel like you can help me, could you point me in the direction of somebody that you feel like could? So I really wish we would stop practicing medicine like in these big just silos and sort of saying that's not what I do, or, like everybody does. Everyone who takes care of women should know something about women's health and what we're going through outside of a pregnancy. So
absolutely. Yeah. And I think, don't take no for an answer. I think that's so important.
Yeah.
Absolutely.
Yeah.
Well, I'm going to say thank you so much, Dr. Kat, and thank you so much, Dr. Hahn, for just being here tonight and for being willing to give a little bit of your guys' time. I think this was just a great conversation. I love getting to hear, I think, just two people that are passionate about what they do and really supporting women. I think that's like such a great conversation just to get to listen to and be a part of as well, for sure.
Thank you so much for taking the time to come and join us, Dr. Hahn. It was great.
Absolutely.
Yes,
so good.
Yeah.
I got to pawn the children off on my husband. So.
Nice.
This is like perfect.
Always a good excuse, for sure. Absolutely.
Yes. So thank you so much for having me. This is awesome. I always love having conversations like this because you learn so much, even just from the questions that come up and everything. So yeah.
Absolutely. And I'm sure the women that couldn't join us tonight will be watching this back on the replay, and hopefully share it with your friends. So ladies, those of you that attended, thank you so much for taking time out of your evening, but don't gatekeep this information. Like, share the link to the replay with your girlfriends, talk to them, and at your, organizations and, reading groups and things like that, let them know this information is out there.
Absolutely. Completely agree. Well, thank you everyone for being here tonight. And I think Dr. Kat said earlier as well, but if you're ever interested in more information, we do have the Menopause Hour podcast. That's a great thing to listen to. It has tons of information. We also have tons of articles on our bywinona.com, which really goes into a lot of detail about all of these topics as well as the fact that if you are already a Winona patient or are interested in becoming a Winona patient, is that your Winona doctor is available 24/7 as well in your patient portal, just to chat through kind of just like this and ask questions. So we always just like to kind of point everyone in the direction of, here's some answers, here's where you can find some information. I think that's such an important aspect to kind of touch on as well. But yeah, thank you everyone so much for being here tonight. And I hope that everyone has a great rest of their night, afternoon, whatever time it is where you're tuning in, for sure.
Yeah, and if you're on social media and you want to follow, you can follow me on Instagram. Dr. Hahn, do you want to give them information about where to follow you?
Yeah, sure. I'm on Instagram, Facebook, LinkedIn, anywhere. But it's Taylor Hahn, HAHN, and .md. So
Amazing.
And then my Instagram is at Dr. Kat OBGYN. So you'll find all kinds of information. I think both of us like to share educational stuff for patients.
Yes.
Yeah. I mean, the more we get more information out there, we are helping all women everywhere, sharing this information. So
absolutely. Yeah. And then my Instagram is
I love it. Give it, Maddie.
No, I don't think
get it out there.
I love it. No. So maybe sometime. Well, thank you guys again so much for being here tonight. And hopefully we'll get to have you again sometime, Dr. Hahn. I think that would be great.
Absolutely. Would love to. Yeah.
Perfect.
All
right.
Good night, everyone.
Have a great evening, guys. Bye, all.
Bye.
Thanks for spending time with us. We hope today's conversation helped you feel more informed, more supported, and a lot less alone. If you're ready to go deeper, download the Winona app. It's free, it's for you, and it's filled with resources, real stories, expert insights, and a vibrant space to connect with women navigating the same season. Have questions? Join our next live Q&A. Until next time, take care of yourself. We'll be here when you're ready for more.